Nizar Nakshabandi. I'm a professor of musculoskeletal radiology in Riyadh, Kingdom of Saudi Arabia, King Saud University Hospitals. And I also have affiliate position in Calgary, Canada.
When did you arrive in Dubai for the conference?
I arrived yesterday, and it was a perfect flight.
Yeah. What sessions and workshops are you participating in?
So the sessions I participated in is I gave a lecture or a talk this morning about debates around vertebroplasty and kyphoplasty, which is a question that most interventional radiologists ask about whether they should go with just injection of cement into a fractured vertebral body or injection and inflation of a balloon inside the vertebral body. That workshop we're presenting today is more about hands-on and how to do the procedure and how to avoid complications, what more advances that can be performed in the future.
Out of those presentations you just talked about, which one of them would you like to highlight to the audience and delegates?
The debates on vertebroplasty and versus kyphoplasty, because it remains a big question, and with the economics of hospitals and austerity measures that the hospitals are facing, vertebroplasty remains a cheaper option compared to kyphoplasty, which is a much more expensive option, both giving the same results, patients preferring the vertebroplasty, which is quicker and with less complications.
Okay. Without going into too much detail about that presentation, can you give us a little bit more information about it?
Well, with people who are osteoporotic or have low bone mass density or have metastasis to their column, their vertebral column, can get a compression fracture. It's extremely painful. So conservative measures usually do not help. So they're bed-bound. So with doing vertebroplasty or kyphoplasty, you're injecting polymethyl methacrylate, which is a clinical cement, into the heart of this vertebral compression fracture. That kills the nerve endings at the compressed vertebra, which immediately takes care of the pain in 90% of the patients. But the fracture has to be acute. It doesn't work for a long-standing chronic fracture 6 months ago.
Okay. How does this particular presentation impact the practice of interventional radiology?
Well, it impacts it specifically on patients' health, hospital economics, and relieving patients' pain as well.
Okay. Have you participated in the Paris Congress before?
I have, as an audience, but this is my first time as a presenter, so I'm quite excited about it. Okay. It is an honor.
Can you tell me how you feel about the changes to the conference?
It's growing. Like musculoskeletal interventional radiology, which is the part that I do, used to get very minimal 1 or 2 hours in the whole 23 or 25-hour conference from a continuous medical education perspective. Now we're growing. We're getting a day and a half. Next year, probably 4 days. So it is potentially growing subspecialty in interventional radiology.
Okay, is there anything you'd like to see for next year's?
We'd like to emphasize more on radiofrequency ablation for knee pain, for lumbar spine pain, which is killing the nerve endings by means of radiofrequency ablation, so the patients do not feel pain, which usually helps with patients who have degenerative disc disease or osteoarthritis of the knees or osteoarthritis of the shoulders. It's extremely helpful in relieving their pain. And when it's done under image guidance, you're pretty much sure it's done properly.
Okay. Have you had a chance to explore Dubai?
Today. You're welcome to come.
Okay. Do you have anything specifically that you're going to do or go see?
I'd like to go to see that cool museum. Have you seen it? The comma-shaped museum? It kind of looks cool. It's a future museum.
Future?
Yes.
Okay. Yeah. That does look cool.
Yeah.
And when do you plan on leaving?
By the end of the week.
Okay.
It's going to take
the most of your time.
Absolutely. Take a couple of days off, and my wife will be flying in soon.
There you go. You get to enjoy it with her.
Great.